For adults who want to add to their major depressive disorder treatment, tap into your brain's power to take on depression. Introducing Rejoyn, the first and only prescription app that's an add-on treatment for depression symptoms. But wait, a prescription for an app? Unlike wellness apps, Rejoyn is classified as a medical device and was authorized by the FDA after being studied in a Phase 3 clinical trial. Rejoyn requires a prescription from a healthcare provider. Over the course of 6 weeks, Rejoyn helps train your brain with proven brain training exercises and short skills-based therapy lessons. Rejoyn is brought to you by a healthcare company, and the patented brain exercises in Rejoyn were developed and studied by a team of psychologists, psychiatrists, and neuroscientists. In a clinical trial, adding Rejoyn to an antidepressant reduced depression symptoms without side effects. Rejoyn treats depression symptoms differently. For some people with depression, the feeling part of the brain, the amygdala, and the thinking part of the brain, the prefrontal cortex, have trouble communicating. This makes it difficult for the brain to process emotions. As a result, as negative emotions become more and more powerful, it can make people feel like they're spiraling. That's where Rejoyn comes in. It taps into the science of neuroplasticity, the brain's natural ability to change. Rejoyn's brain training exercises are designed to activate the thinking and feeling parts of the brain at the same time. This helps to strengthen the connection between them, so they're able to communicate better. This may help the brain process emotions, improving depression symptoms. Think of it like physical therapy for your brain. With regular practice, doing targeted brain training exercises can change how your brain works. Brain training exercises involve identifying and remembering emotions on a series of faces. To help you keep making progress, the level of difficulty will adjust as you move through the exercises. Each exercise typically takes about 20 to 30 minutes to complete and is done 3 times per week. For a more in-depth look at how to use the app, watch a video that takes you inside the app on the Rejoyn website. In addition to these exercises, short skills-based therapy lessons teach you skills that can help with managing depression symptoms, including handling strong emotions, reframing negative thinking, and taking positive actions. Each lesson takes about 5 minutes and is done 3 times per week. It takes work to change your brain, but don't worry. Rejoyn comes with built-in support. Rejoyn sends you motivating text messages to reinforce the exercises and lessons. You can also sign up at any time to receive support calls from a nurse. So, now that you've learned how Rejoyn can add to your current treatment and help you take on depression symptoms, are you ready to open up to change? Connect with a healthcare provider today about Rejoyn. Rejoyn is a prescription digital therapeutic for the treatment of major depressive disorder, MDD, symptoms as an adjunct to clinician-managed outpatient care for adult patients with MDD aged 22 years and older who are on antidepressant medication. It is intended to reduce MDD symptoms. Rejoyn is not intended to be used as a standalone treatment. Rejoyn does not replace your current medication, including medication for treatment of MDD. You should continue your current treatment as directed by your healthcare provider. Rejoyn cannot send alerts or warnings to your healthcare provider. If you feel that your depression symptoms are worsening, or if you have feelings or thoughts of harming yourself or others, please contact your healthcare provider, dial 911, or go to the nearest emergency room immediately.